Medical billing is more than an administrative function. For many practices, it is the primary site of silent, unchecked revenue leakage. Much of that leakage stems from systemic staffing instability. Data from the Medical Group Management Association shows that 1 in 3 business operations support staff members leaves their role every single year. Replacing these workers is a massive capital drain. Finding, hiring, and onboarding a single frontline billing professional costs a practice between $25,000 and $30,000. An empty billing seat acts as an active liability. It siphons away cash reserves through lost productivity and missed opportunities long before a new candidate even walks through the door. For practices running on DrChrono, the staffing challenge carries an even steeper learning curve. DrChrono utilizes unique charge capture workflows and specialized claim scrubbing logic. Standard experience in other EMR platforms does not translate to immediate competence in this environment. A new biller requires 60 to 90 days to master these specific protocols. During this ramp-up, productivity stays low while the error rate spikes. This delay directly impacts your balance sheet. Clean claim rates drop, accounts receivable age, and uncollected cash climbs. Bringing in a replacement hire starts a 90-day window of guaranteed financial underperformance for your revenue cycle. This staffing instability is colliding with a second variable, the rising volume of payer denials. In 2024, the average claim denial rate reached 11.8%. For Medicare Advantage plans, providers faced a staggering 59% increase in denials in a single year. However, GBBS healthcare data reveals that over half of these denials are factually incorrect. They are recoverable sums that can be overturned in the provider's favor. Recovering that money requires consistent labor. When a billing team is understaffed, complex denial appeals are the first tasks to be deprioritized and eventually abandoned. The industry benchmark for healthy accounts receivable is 30 to 40 days. A growing pile of unworked denials pushes practices far beyond this threshold. High turnover and rising denials create a structural bottleneck. Without the bandwidth to challenge payer errors, recoverable revenue eventually becomes a permanent write-off. The total loaded cost of maintaining one in-house biller typically lands between $55,000 and $75,000 annually. That figure includes more than salary, employee benefits, payroll taxes, training time, and software seats. Compare that to the Staffingly model. It provides the same output for $399 per week, reducing staffing expenses by 50 to 70. Most practices are paying a high premium to support a fragile in-house model that produces lower financial returns than a dedicated expert team. Staffingly bypasses the friction of traditional outsourcing with a 14-day go-live timeline. Onboarding involves a direct workflow mapping kickoff, followed by establishing secure DrChrono EMR access within 48 hours. These specialists work directly inside your existing DrChrono environment. They use your established templates and workflows, avoiding the need for disjointed third-party portals. Every step occurs within a secure environment, verified by HIPAA, HITRS, and SOC 2 Type 2 certifications to ensure your data remains protected. This approach transforms outsourcing from a chaotic transition into a seamless, secure integration that ends the cycle of constant hiring. Staffingly augments this human expertise with AI-driven workflow management. Predictive smart routing analyzes claim data to direct complex tasks to the most qualified specialists, while automated audits catch coding errors before they are ever submitted to the payer. By combining this technical oversight with DrChrono-certified specialists, practices see an average 80% reduction in denials. This increased accuracy often brings accounts receivable down to just 12 days. The service requires no long-term commitment. It operates on month-to-month terms and includes a 14-day risk-free pilot scope. Stop funding your own revenue leakage through turnover and unworked claims. Book a demo with Staffingly today to secure your